हेलो। हाँ सर जी। हाँ। ओ माय गॉड, इतना इतना हिंदी सुबह सुबह कैसे? ओ माय गॉड। नहीं 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 नहीं। No, no. I'll come office near about 10:15 because 9:30 we have that group session. So I'm just joining this group session. And sir, data, seriously, sir, data. हाँ हाँ हाँ।
విషయాలు మరుగున పరుస్తుంది. అది ఎందుకు చేయండి, మేము అలా చేయమని చెప్పాం కదా. ఈ బిల్లు ఇలా ఆలోచించమని ఈ బిల్లు
Hello everyone, good morning. So once the speaker is done, in 5 minutes we can start the session.
Yeah, okay, good morning.
Yeah. Hello, all apologize. So ma'am is joining the call. So just take another 5 minutes. I think so. She's on the call. Yeah.
Okay.
Hello.
Hello.
Yeah. Hi, ma'am. Good morning.
Hey, good morning. Sorry. Sorry. Can you see me now?
Yes. Yes. Perfect. Perfect, ma'am. It is perfect.
Okay, awesome. My apologies. It showed up as 10 o'clock on my side,
Okay. Okay. Okay.
10 o'clock Pacific time. So I thought that's when it was. It's not showing up the right time for me.
Okay. 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 No, no problem.
What is it showing up on your side?
So it is at 9:30, ma'am, actually. So it is 9:30 IST. Somewhere it might be missed.
Yeah, why is it showing up at 10 to 11:30 p.m.? I don't know.
Okay.
Yeah.
Yeah.
My apologies. Go ahead.
No, no, no problem, ma'am. So, ma'am, we have our startups. So we have around 12 startups which are working in healthcare sector
Sure.
in this program.
Mhm.
Probably before the session, I'll just even ask the startups to give a brief introduction about their company. Just 2 lines of introduction so that you'll be getting the stage and the sector of startups where they're working in.
Sure, sure, sure.
Yeah. Before this, I'll just start with introduction of ma'am. So, Mr. Dr. Jayanti Subramaniam ma'am currently she's the CEO of Doctorate. It is an behavioral health company. So, ma'am has previously experienced working with companies like Capgemini, Tata. Next, as also she been working in Tech Mahindra for some time as in healthcare service. So ma'am has very good and experience in corporate sector and also more into understanding about the private healthcare sector. Yeah. So ma'am, I'll just start with Dr. Vimala Garu to just give a 2 lines introduction about herself.
Sure.
Hello, Andy. Hi.
Hi there. Good morning. My
Hi.
apologies, folks. It showed up in the wrong time zone for me.
No problem.
So
Dr.
my apologies.
Jayanti.
I'm generally never late. Okay, go ahead, please.
I'm Dr. Vimla, and ours is Sanjiva Homeopathy. We are a startup in homeopathy field. Ours is a chain of homeopathy clinics. I have done my clinical research in few diseases and came up with a protocol with which we can treat the patient permanently. We will give a permanent cure. So
I see.
I have slowly developed a software where it gives us the protocol. So we use digital healthcare system so that there is a case taking sheet over there, which is filled by the doctor. They see the patient, diagnose the case, and accordingly with the disease, they give the protocol which is available in the clinic.
Got it.
And we also suggest them a few diet restrictions and all. So it is a complete cure which we offer for certain commonly seen diseases like thyroid, diabetes, PCOD and all, skin diseases. So I would like to expand our clinics further to franchise few branches and few of our own clinics also. For that, I have joined in this one.
So how many clinics do you currently have right now? I mean,
Currently, we have 4 clinics.
I see. In Hyderabad?
3 are in Hyderabad, 1 is in Medak.
Okay. And then you want to expand it, including franchise and your own clinics. Wonderful.
Yeah.
So the way we want to do this is, do you want everybody to introduce themselves before we go into it? How do you want to do this?
So we can initially we can just have 2 lines of introduction about each startup so that you'll be understanding about the.
Got it. That's best.
Yeah.
Very
Okay,
nice to meet you, Vimala. We'll wait. We'll definitely have a discussion.
Yeah,
So
definitely.
next we can go with Arvind Sinha ji from Health Compass.
Hey, good evening, Dr. Jaya. My name is Arvind Sinha. I'm founder of Health Compass. we are actually trying to bring the consumerism to healthcare, and we are trying to do that by creating a patient-centric application which enables patient as well as the doctors to participate in their health journey, and we want to be guiding them like a compass in their entire journey on both sides. That's briefly about us.
Okay, I have a lot of questions, but I'll wait for the introductions to get over. Very nice
All
to
right.
meet you.
Same here. Thanks.
Next, we have Sahiti from HSL.
Hi, good evening. So our startup Hetzol Biomed is like a bioelectrical medical devices startup. We develop a lot of bioelectrical devices. One of them, for example, is a temporary pacemaker, and the other is a femtech device. Thank you.
Thank you.
So next we have Partha from Curix.
Yeah. Hello, doctor.
Hi there.
Yeah. Curix is a cloud-based hospital information management system.
Mm-hmm.
So we are trying to make difference by solving the last mile delivery challenges and giving transparency to the management.
Okay, awesome.
So next we have
So much new things.
Second consult.
Second, so you do second consult?
Hi, ma'am. I'm Prashant. So we are basically an online teleconsultation platform at the moment, and we will be basically furthering our particular venture into second opinions, connected healthcare, and lab and radiology services. So we'll be acting like a booking platform there.
Okay, like a booking platform, you said?
Yes, and basically it's an e-commerce platform. We'll be an aggregator for various of the labs and hospitals which want to register their services on board, and also provide teleradiology services for the labs that don't have radiologists.
Got it. Wonderful.
So next we have Murganathan from Medifort.
I think he's on mute.
Yeah, Murganathan ji, you can unmute.
Yeah. Good morning. Sorry. Good morning, Chaitanya and Jayanti ma'am.
Good morning.
We started our health services in home care during the COVID period and trying to fill the gap and demand on the same, and working on the digital platform to promote lab services, doctor consulting, health insurance, hospital supplies, like that. We are developing the platform and mobile applications.
For home health services.
Yes. In addition to that, we are trying to open up our own pharmacy and lab, diagnostic lab like that. Yeah, our own brand. Wow. Thank you, ma'am.
Yeah. Next we have Srinivas ji from Tamsar Telehealth.
Yeah. Hello. Good morning, Dr. Jayanti.
Hi. Good morning.
Yeah. Our company is Tamsar. Tamsar is an acronym for Telehealth and Medical Services in Augmented Reality. So, yeah, we have developed a software system for actually connecting a patient with 360 degrees of the healthcare ecosystem, Indian healthcare ecosystem. So this system is accessible as a mobile app as well as a responsive web app. But unfortunately, more than 60% of the 65% of Indian population, they live in villages where the healthcare facilities are scanty or nearly absent. So we want to target rural patients. We want to make healthcare and medical services available, accessible, and affordable to all the people, irrespective of geographical or financial constraints. So in line with this, we are proposing to establish a chain of state-of-the-art telemedical centers, which will be known as Tamsar Digital Clinics, where it will serve as the first point of medical care to the people of the village. Means villages, they don't have to undertake any expensive medical trips to urban centers to get treated for their health issues, or they don't have to compromise with the low quality or poor quality medical treatment that is getting provided by local quacks, medical quacks, also known as RMP doctors. So this is the basic issue that we are trying to address. So we are actually planning to set up a chain of telemedical centers across rural India. Means we have around 665,000 villages And we want to target at least 10% of the remote villages where we can bring them to the mainstream as far as telemedical consultations are concerned. So apart from the main telemedical software center, which is a real-time video-based consultation platform, we have integrated point-of-care devices to the software so that patient vitals can be captured and uploaded to the cloud, wherein the remote doctor, he can have first-hand on-time access to the patient data, and based on that, he can actually prescribe the further course of action. So this will also act as a patient sample collection center, wherein the digital clinic will collect the samples from the patient and will forward to the higher level, that is at Mandal headquarters level, where there will be laboratory facilities. And in case of medicines, Mandal level headquarters will have the main stock point from which the medicines will be dispatched to the respective patients in different villages. In case of hospitalization requirement, which is less than 10%, 30%, people, they can be routed to the main hospital, which is located at a district or the town or city nearby within the radius of 50 kilometers. Our strategy is have a strategic tie-up with established hospital and then build telemedical centers around them within 50-kilometer radius or less than that, so that any hospitalization requirement or inpatient requirement can be actually diverted to this particular hospital. So this is only a default option, but as such, our platform, it provides a lot of flexibility to the patient in terms of choice of medical system. We are not confining to Ayurveda system, so allopathy system. We are actually extending this to AIC system of medicine as well as herbal medicines. So this is what we are going to do. We are going to extend the services even to the veterinary care, so that people in rural India, they have a lot of hardship in getting treatment for their animals, domestic animals like cattle and other things. So this is what is the brief introduction. And coming to my own introduction, I'm a computer engineering graduate and I have around 30 years of experience in IT industry. I worked in senior management in reputed multinational companies like Samsung Electronics. I worked with QA as quality consultant. So out of passion, I've started this venture. Yeah, this is my introduction. Yeah, thank you.
Thank you.
Thank you, Srinivasi. So next we have next only two. There are two more startups. So we have Yashpal from Yashbaya Solutions.
Hello, good morning, everybody. Am I audible?
Yes, Yashpal.
Yes, now you are.
Good morning, everybody. Good morning, ma'am. Good morning. Myself, Yashpal Matangi. I am qualified dentist and I am into. We have come up with a novel medical device addressing management of drug addiction. We have come up with the patented medical device which can reduce craving and improve withdrawal effects. And we are in clinical validation state now. Thank you.
Thanks, Yashpal. So next we have Narendra Reddy from Methods.
Hi, ma'am. Morning. Methods is healthcare to home care services. So we required physio, doctor, and home caretakers. So we are providing those services.
Got it. Got it.
Thanks, Narendra. So last we have
home care services, is it? Hello?
Yeah, ma'am, can you just repeat it again? I think so.
No, you are a home care services, right?
Yes.
Oh, I just wanted to make sure that I heard you clearly.
Yeah, next, last we have Kaushik from ITSM.
Hi, thank you, Shravan. We at Itos Health are building a precision care digital twin platform for our providers, where currently the healthcare silos that are affecting providing appropriate diagnostic care or differential diagnosis is causing like almost 10% of death every year annually. And that's the problem that we want to fix. We have a multi-data model which kind of is helpful in bringing out precision care where we can reduce the inefficiencies that occur with our workflow automations that we have. But so our current user base is like hospitals or providers. And for any of these health analytics in terms of understanding big data and healthcare, we have built our models which could be helpful. So if you're trying to understand at a macro or a micro level, if a certain disease is prevalent in a certain area, that is something that would be one of the use cases that we can solve.
Okay.
Thanks.
Thanks, Kaushik.
So
Yeah,
is that the last person, or do we have any more?
Kaushik.
Kaushik. We have one more person, right? Did I hear you correctly?
No, no, no.
I think
Okay, so he's the last person?
Yes, yes, Kaushik is the last person.
Okay, got it. Awesome. So I heard each one of you. I mean, I'm just amazed at the level of innovation, thought process, trying to identify a gap in the system, and how each one of you are bringing something new to the table. It's just amazing. There is 15 of you and or 12 of you, and each one of you have got a different way of addressing the problem. So that's just that goes to show, first and foremost, I think the first of all, the opportunities that exist in healthcare, especially in private healthcare in India, opportunities are just humongous. Second, it goes to show how obvious it is that you all have been able to identify. Some of you are from healthcare, some of you are not from healthcare. Maybe some of you were consumers, and you were able to, and some of you have mentioned that you're engineers that have been able to identify gaps that are so wide and gaping, that you've been able to come up with a solution to address that particular need. So that goes to show the opportunities that exist, and the ability for you to have a role to play where you can become really successful identifying that opportunity, as well as to be able to serve the population that you so intend to do. So I think both are really wonderful. Now, I heard two of you are from home health, if I'm correct, right? Two of you have home health based offerings. And there is one that is addressing the rural market with the augmented reality. There is a couple of you that are in the biomed space. There is one that is in the pharma, kind of trying to create a pharma space, and then a few others. So those were what resonated with me. And then there's one on Health Compass. And then there was one that is addressing the last mile, one that was a second consult. So just the whole spectrum of what we need in healthcare today, and that is being addressed in different markets in various ways, are being addressed in India now, looks like. So this is all digital. I'm assuming all of you are using some form of technology or digital play in addressing these issues. Am I correct?
Yes, yes, absolutely.
Yes,
Yes,
ma'am.
yes,
That's
yes,
good.
yes, ma'am. Yeah.
So you all have some form of software or technology, or you built some sort of a platform to be able to do the services. And how many of you are B2B versus B2C?
Ma'am, Health Compass does B2B to C actually. Our mode is to acquire consumer through doctors.
Through doctors. And in Health Compass, you are the one who basically tries to give the consumers their ability to kind of take control of their health. Am I
That's correct.
in the right?
That's correct.
Okay.
Right.
And you're going to do that through doctors, so they can provide your app or the platform to the patient, so they can better control through remote patient and all other different ways, their own health. They are in charge of their health, and they can also upload their information, something like that.
Yes.
Am I correct?
Yes,
Okay.
Exactly.
Okay, I think I got you. And then how many of you are, so one is B2B2C, how many of you others are B2B, if I may ask that?
Curix is a B2B, ma'am. So we want to provide technology for the hospitals to simplify their operations and improve the patient care.
Okay, so that's definitely that's hospital based. So
For
that's
Health Biomed, we have based on our devices. So the temporary pacemaker is a B2B, the Femtech device is a B2C device.
And that will be B2C, but shouldn't that be B2B? Like, shouldn't the doctor be recommending those?
It's not a risk C category. It's a personal health device.
Got it. So it's B2C, so people can actually buy it and keep it, especially if they have any heart condition, heart issues. Okay, got it. So that's nice. So there are some of you that are B2C, some of you that are B2B. Now, given this, so how from T-Hub, I forget your name. I'm sorry.
My name is Shravan.
I'm sorry. What?
Shravan.
Shravan. I think I've talked to you before, but tell me, how do you see what conversation with the team here would really help them? You know, some of them are part of T-Hub, right? Am I correct?
Yes. All the startups are incubated in T-Hub now.
Incubated in T-Hub. That's fantastic. So and you have a pulse over them. So what do you think would best help them?
So majorly the support to the startups, how to go to the market is a major challenge.
Got it. Yeah. So let me ask this question. How many of you are focusing only on India or other geographies?
Health Compass wants to start with India, but then we have plans to expand further.
Okay. Anyone who is expanding, who's looking at other geographies first, or you're all looking at India first?
First, we need to target Indian market. And then later on, we actually want to expand to overseas locations for medical tourism purpose. Like we want to set up our digital clinics over overseas locations and then divert them to Indian healthcare system for medical tourism purpose.
Got it. So most of you have started with Indian market. So let's start there.
So I would, sorry, let me just add. We at Hydros started at US, and trying to break into the silos within US is very difficult. Even with our connections with doctors is quite strenuous, and that's the same in Indian market as well. So I come from a family of doctors, but finding these people who have the problem is the key thing, and you would have discovered in your journey as well, right? And I'm hoping to understand how you went about it as well.
Okay, so you know what may be helpful to you. You all tell me if this will be helpful to you. I'll give you a little bit about our journey, how we started. I'll spend about 5 minutes just going over how we started really breaking through. And then you can get a sense of that. And then as you keep asking questions, I can answer it. That may be a better way to handle this because each of you may have a very specific need or ask in the go-to-market that may be different from others, right? Each of you are facing a different set of challenges based on B2B, based on the doctor community, based on the hospital community, and they're all kind of, you know, for lack of a better word, gangs, right? they're in their own little gang. So you have to learn to break through them. And then that can be difficult. Even if you have connections, it can be difficult. So I'll just give a brief about how we started this journey. So I have been a chronic, actually, I'm a healthcare professional myself. I've been in the business in the United States for 30 some years. And then I decided to, you know, in the middle of these 30 years, I decided at some point I developed a whole post-acute EHR there was a company that brought out the EHR that was a technology company. And they didn't really get the clinician needs. So I actually took that EHR and evolved it into what today stands as one of the leading post-acute EHRs in the country. And I did that for 1,200 facilities across the United States. So I and a bunch of clinicians, a clinical team that I had, we kind of built it out together. That's when I realized healthcare professionals have to be in the technology space if we want technology to be used appropriately and used for usefulness, right, for both patients and the clinical community. So then I moved into some of these services company to better understand what it is that they do in technology. And by virtue of being in these companies, what I found out is a lot of in the technology world, people really, they knew the problem. They were able to develop a fantastic technology solution. And most Indians are good in technology. So they develop wonderful technology products, but they don't know how to position it or sell it to a clinical community. because they don't speak the same language. It's like you speaking Telugu and I speaking Tamil, it doesn't work. Okay, so that was the biggest breakdown I noticed with the selling. So by happenstance or by accident, I ended up selling for most of these healthcare, for these services companies I worked with. I never had a sales title, whether I was a VP or whatever, it didn't matter, but I ended up selling for clients because I was able to speak the language. And so that's when I realized it's not only enough to build a brilliant product, right? It has to be at the end of the day, end user friendly. Can the person use this? Number one. Two, can you speak the same language, understand the problems and empathize with it the way they experience it? You may think your product is brilliant, but when you roll it out to them, when you explain it to them, and they start clicking the buttons, and most healthcare professionals are technologically not very savvy. So when they start using it, they should experience it like a Apple phone or an iPhone. You know, iPhone was not a need, it was a luxury when it started. But now, you know, for me personally, I wouldn't be able to live without iPhone. Even my mom knows how to operate iPhone. They made it so user friendly, right? And that became almost a need now. So that's how you really want to, at the end of the day, bring your product to a point where the clinical community is able to understand it without any explanation, without a video, without a manual, without you having to sit down and handhold them. They should be able to click through and say, this makes sense. When you get to that point is when you're won over that community. So your product has to get there. So the positioning of the product, and you won't get there perfect the first day. So it's a work in progress. So you start rolling it out. You have to find the first few clients who want to be beta sites for you. And they know they're going to take the risk with you. They know that your product is not fully ready. They know they will have to give feedback. There are a lot of different journeys that they have to be ready for. And many of them may not be ready for it right at the beginning, but if you upfront explain it to them that you would really like to collaborate with them and you're really seeking their help, many times when you seek it as a help, they're more than willing to come around. Second, many times when you go for a beta site, they may not be willing to pay you the full price or whatever it is that you're trying to roll out. It may be at a very discounted price. So you have to recognize, and funding is always a perennial challenge in startup. That's another thing that, you know, we all recognize. So you have to parallelly go for funding while you're trying to get this product out and get it adopted in the market. Three things have to happen at the same time. While this is happening, you have to have a fourth arm that is going after newer and newer accounts, because you're going to need volume in order to really test and mature this platform or the product that you have. So these are four different activities you have to do. So when a pandemic hit, you know, I have a couple of other friends, and one of them is Rajini Kasu, who's also a mentor in T-Hub. She's our technology person, the brainchild behind our technology and the platform. So when she already had a business going, and it was in the hospitality industry, and when COVID hit, it all was affected for her and her partner. And both of them are friends of mine. So we were just puttering around, and we ended up doing telehealth platform. We have a fully mature synchronous and asynchronous telehealth platform within our ecosystem. And then when we built that out, I realized I didn't see that it was, by that time, thousands of platforms had come. They're being rolled over left, right, and center, and I didn't see that as a unique positioning. But what I did know is there was a lot of mental and behavioral health needs in the market that was not being addressed. So at that point in India, we started rolling our platform out to the universities, and we didn't do that at a price. We just gave it for free because we wanted to use. But when you give something completely for free, nobody uses it. So you never get any feedback. That was a lesson we learned. So what we did is we said, we put a very small amount of money, and we said, you have to pay us something annually for you to use it. Because when there is a payment that goes out, people are more than willing to come around and give you some data and force their people to use it, whatever, right? Give you time. So we started doing that, and we kind of played around with it in the mental and behavioral health space. And we did first as a B2C for the students. And then we quickly realized This is great. It's wonderful. It was working well, but the volume that we will need to make the kind of revenues we were looking for the kind of funding we were looking for, would not really match each other in Indian geography. And my experience was fully US healthcare. From a very young adult stage, I have been in US, and I realized I would best do justice to this if I went to US market with it. So I was very fortunate. The clinical community really embraced us so well. I mean, I am actually shocked and surprised. So we got the first client on January 1st. We did a rollout of our platform, a demo, looking for investment funding. We got both funding as well as clients. We got first four clinics, then we got 3 more. So actually, no, 2 more. So we've got 6 clients now. We are looking for 4 more. So we want to close at 10 facilities this year, 10 clinics this year. And our goal was only 6 clinics. Okay. We were just doing the beta testing, but we got more than what we needed. So we plan to close it at 10 and make sure our products is fully tested. And the kind of support, the encouragement, and the enthusiasm we received from the physicians is not usual or typical. It is very unusual. Maybe the stars were aligned right for us. I don't know. But that's the kind of support we got. In fact, just before this call, I came from another physician who was interested in helping us to get to another few more physicians, which really surprised me, actually. So when, and that was because, when I talk to these physicians, I'm able to talk their language. That was the first thing we realized. So there was a difference when I spoke to the physician versus the technology person speaks to the physician. That's the first difference. Second is, when we went to them, we didn't go to them saying that here is our product, you use it and tell us the difficulties. We didn't do that. We said, our product is in the early stages. So we want you to roll it out for yourself. Sure. But at the same time, we will be there with you, working with you to see what works and what doesn't work. And we will continuously improve this platform as you're rolling this out. And we will take the onus of doing all the fixes, changes, reaching out to your staff, everything. So we will take away any pain or any extra time you have to give towards us. So that was the condition on which we actually came. And that's the reason, even though I'm from Texas, I'm actually sitting in California for the last 1.5 months. And I plan to be here for another 1.5 months, going one clinic after the other every day, making friends with the staff, making sure they adopt it, making sure that they get learn. That's what we did. So having said that, I feel like, for us, how it worked is because we did the investment, raising funds from the physicians, and to the same clinics, we are rolling this out. Third, we are investing our time and energy and focus sitting in that facility, helping them with it rather than asking for their time, and collecting the data in a passive way so we can fix whatever we need to do. And fourth is really seeking newer clients as we go through this journey. That's the 4 things that we have done. I'm going to shut up here and ask you all if this journey made any sense to you, if you saw anything that resonates with you, anything that you see as a challenge, and if you can ask those questions, it can become interactive. Anyone?
Thank you for your intro.
So, Dr. Jaya, this is Arvind from Health Compass. I think I 100% resonate with this journey because, we also got our first customer in January. And it's like, for us, it's like not a clinic, it's like per user based. And then in February, we got our second. And through those 2 facilities, we got around 25 users. Unpaid at this point in time. However, they are giving me a lot of experience, as you explained, like what should be the outcome of it. And we also end up placing our own guys at the clinic so that we don't take away the time from them and help them in getting familiar with the tool in a very organic way. So it resonated quite well with your journey. And I think our takeaway from this 1 or 2 experiences that we have to help clinicians out because they are like so busy, and many of them, especially in tier 2 cities, their footfall is so high for the lot of them that adoption is a huge barrier from that perspective, that if system takes like 5 minutes, they don't have that 5 minutes to use it for the enabling the digital health.
Yeah. One of the things I also learned, how many of you have patient apps in this group?
Sorry, what app, ma'am?
How many of you have a patient-facing app?
Oh, that's me. I do have a patient-facing app.
Okay. So how many of you out of the ones that have patient-facing app have experienced that the adoption is just sucks? It's really poor.
Poor as in like it's not available or it doesn't help?
Poor in the sense that it's very hard to get a patient to adopt to an app. Do you feel that that journey has been more difficult?
So actually I have a different challenge over there. So we have a doctor who is our advisor. So at her practice, patients are actually more adaptive to it. There are some individuals we are piloting with. They are enthusiastic about it. However, the challenge we have is doctors are very apprehensive about releasing that information to the patients directly. Right. So we are not able to make 100% use of it the way we have designed it. Right. So our design is that patient is a player, like I explained earlier, that we want to enable them. Right. So they come prepared for their consultation, and then they have means to collaborate with their doctor. In that they are active players. But doctors saying that, I don't want to release, I mean, not all of them, but many of them, their argument is like, I don't want to release it to patient. And then
you may, this is a common problem because see, they're used to having control over the patient's lives.
That's right.
Okay, and so now suddenly you're saying let's make the information available. Their fear is twofold. Right? As a clinician, I'll tell you, one is the fact that they don't want the information to go out, just as it is, because God forbid if the patient reads everything and gets all muddled up in their head, because the internet is available, they'll read upon it and they'll become a Google doctor and then they'll come back and question it. So that's one fear they have. The second fear they have is if they get access to that information, will it consume a lot more of their time, right? That will be the second fear where they will have. So it's basically, it's their own fear and limitation that's stopping them from sharing. So maybe what you want to do is sit with the doctor and see, you tell us what pieces of information you would really like to share, or okay, if you are sending right now, we are exposing the summary visit to the patient and you feel like this is not the way to do it. You tell us what pieces of this information the patient should have. So they have, in a layman's language, some pieces of information. If nothing else, if that's all you want to give is a set of exercises to the patient, let's do that. So start small and you will find that option to be better and less resistance. So you will at least get the starting point with the physicians.
Yeah, I think the third angle, Dr. Jaya, which I'm hearing mostly from most of them, is about the medical legal aspect of it. If information is available, then they are more vulnerable, while we think that's other way around, right? Which means you are more secure. So that's one thing. Second thing, it's happening exactly the same way you explained we should proceed forward, like we work with them, what you want to expose, what you not, and we play along. However, the challenge which I would face down the road, it's a SaaS application, right? We can only do so much customization. So basically on the way, we may be seeing some people now, have you,
That's true. But you can also do one more thing. Do a survey, get their buy-in to just send a anonymous survey to all their patients, or maybe 50% of their patients, or maybe 30 patients. I don't know. Whatever. Take a number and just do a survey and get the feedback to see if patients would like their information or not like the information. And let the physician see some data for herself or himself.
Actually, we did a survey before we launch, not like in the context of the patient of a doctor, but general, right? The interesting part is everybody wants it. Even doctors want it, right? Per survey. But reality changes from a physician to physician. So it really matters with whom you land with, right? To do your pilot. So very, very personalized opinion, about. There's no like one professional opinion that this should be this way or that way.
Yeah, clinicians are a tough nut to crack. Anyone else has any other thought process or any other questions or anything that you would specifically like for yourself? I mean, from a go-to-market, because each of your market is very different. Addressable market is different. Your platforms serve different needs. So giving a generic go-to-market strategy may not work. And that will be like a function. I don't want to do that.
Hello, doctor. This is Dr.
Yeah.
Vimla. I would like to ask about, actually till now, it was offline marketing which is there for me. That is mainly mouth to mouth. Do you suggest us to go for online marketing that is mainly social media and other channels? Though we tried that, I didn't get any result through that marketing. So I'm not knowing what marketing have to be done exactly for increasing.
See, a lot of people gave us a lot of advice. Okay, I tell you, this whole business of should I do digital? Digital is better than this, and that marketing worked for her, and she got millions of dollars. I didn't get shit. All this, don't worry about all that. Okay, people will say whatever they want to say. You have to see for your audience, right? Yours is an audience where you have got your own little setup going in Hyderabad, right? You've got four.
Yeah.
Okay. Now, do you need digital marketing? Is your audience digitally savvy that they will be looking at Facebook or Instagram or whatever to look at that? Is that your audience? Then you do some digital marketing. If not, then it's pointless, right? It may be referral based. It may be incentivizing the referrals. Maybe the current market size that you have, maybe you incentivize them and say you bring one more customer, you get XYZ. For example, in our company, we said when a physician brings another physician, there are rules around what we can incentivize in US, because I still hold a license here, so we have to be very careful. But then there are incentivification we do. We can give money if you bring investments, because that's a broker-dealer law that we cannot break. But then we have come around a way where we said, if you bring another physician where you don't have any vested interest in that person's clinic, but they come around and they become our client, you get some shares. So there are ways to work around it based on the laws of the country and based on what you're able to offer from that perspective. Find a way that attracts somebody or motivates somebody to bring you more clients. I think that's the way to look at it. Not, should I do digital or should I not do digital? That's just, two extremes. It may not be both, or it may be both. So look at your audience. Figure out what works best, and you have got some sense of it already in the back of your head. It may not be evident to you now, so you have to do some deeper analysis to see how do you bring this. And what is it? I always look at it this way. I'm really old when I started this whole startup journey. So unlike all of you that are very young, I'm significantly older. So when I started this journey, I realized I have fewer years than most others who start their journey in their 20s and 30s. So I have to find the best way to conserve my energy and yet be able to bring the clients to the table. I have to be really, I have to strategically think about how quickly I can do this happen, make this happen, and what is the stickiness with which I can go to the market. So I have to read each person I talk to. So that's something you have to really get very refined at, right? When you talk to your clients or to your investors or to your audience, whoever your audience may be, start watching what is working, what is making them sit up in the conversation, what is totally, they're like, get out of my hair. I can't even stand you anymore. You can get those vibes, right? And you can see what is working for them. And then you have to change your pitch continuously.
Okay, ma'am, I understood. Thank you.
Okay. Anyone else?
I have a question.
Sure.
So I know that me and Yashpal are a little different because ours is like medical devices rather than digital platforms. But my question has to do with, I know like every continent or every country for itself has like very different laws when it comes to medical devices and how we approach things. So how is it like in US? Like, are there any parallels compared to India with medical devices, how it's deployed in the market? Is there something that we could probably use as a guide to?
I think medical devices, if you're calling your device medical device, then it has to go through FDA clearance. So that's a journey that takes a few years. It won't happen right away. And that funding that you will require will be several millions. So that's what you should aim for. That's not impossible. That is very possible. There are a lot of people who do that. Even sitting in India, I know folks that have got medical devices, got funding, have got clearances both in Europe as well as through FDA for US.
Actually, I meant, I'm not saying that I want to do it in US or Europe. I'm just saying, like, are there parallels to how the device comes out in the market? Because ours is aimed for the Indian subcontinent and for countries that have a lot of economic issue with purchasing medical devices. So ours is like targeted for affordable healthcare markets. So rather than for like the US or Europe markets, which can afford these expensive devices.
Okay, so you're asking what are the parallels in these geographies?
Yeah. I'm just asking, like, how do they approach putting out devices in the market in US?
That's a great question. So see, many of these, of course, once they go through the whole clinical research, they get their FDA approval and whatnot, right? They usually go through the clinics or the doctors and stuff like that, who then push it to their patients and so on and so forth. So that's one way to do it. Then they heavily spend on advertising and marketing if it is to the consumers, and a lot of money is spent on advertising through that. Third, they will partner with entities like Walmart, Walgreens, CVS, so on and so forth, and then try to price it really low or make it some kind of a promotional offer to be able to push it. So these are some of the ways strategically the offerings are positioned in the market. But once they get the FDA clearance, then it becomes easy peasy in the US. So it's not so hard, especially if it is very affordable. Although, if there is a parallel product in the market that comes from, say, for example, the likes of Medtronics, right, that is far more pricier than yours, then that becomes a big challenge because these big giants will not allow anybody that's much cheaper than them to come in the market and be able to sustain and survive it. However, right now, the whole generic market has really taken over in the pharma space. Similarly, for the biomed space, also, there is a lot of opportunities to price your products much cheaper, smarter, easier to use. And a lot of diabetic-based, biomedical products are positioned like that in the market. And there's a lot of stickiness in the market for that as well, consumption in the market for that as well. So I don't know if I answered your question, but, here, once you get that approval, it becomes much easier.
Okay, thank you.
Anyone else? Those of you that I think are doing
Hello,
maybe.
ma'am. Can I ask you?
Sure.
Yeah, ma'am. So I would like to ask you two things. One is, how is the home care market in the US? How does it happen? Because it's the huge money flowing kind of business, as I understand. So comparatively, US to India, how does it? What are the differences? How is the success rate? How is it happening? So what are the difficulties? If you can advise our explain it.
Yeah. So I'll tell you the home healthcare in India too. I've seen some of the leading home healthcare entities in India. I've actually interacted with some of the founders of these companies in India. And I tell you the biggest difference. India is a completely privatized healthcare market. That's where the money is, right? You're not in a non-profit organization. You have to make some money in order to pay your employees, pay for your software, so you can actually make it something more meaningful and scalable. So that's a real hurdle, a real problem you have to solve, right? So you need to have real revenues coming in. Now, with that said, in a privatized market, very consumer end friendly market, right, like India, and a price conscious market, it becomes very difficult if your price of services is at a certain, depending on the price of the services, it becomes difficult to really access those consumers. And even the large home health giants struggle to retain those consumers. That's number one. But more specifically in the home healthcare industry in India, what I notice is it's a service-based industry. Even if you have a platform, even if you are digital, you still need human beings to go take care of the patient. If that is the case, the quality of those human beings, the training that they need, the ability to make sure that that there is a consistency of quality is a major questionable thing I've noticed in India as well. So I don't know if you have a way to solve that problem in terms of standardizing the training, making sure that they all get the same type of training, that there is some way to monitor what they deliver to the patients for a certain number of visits. Using digital thing, making sure that they're timely, making sure that they actually deliver the same quality of care that you promise to the client, to ensure that you have retention, repeat customers. These are the challenges I see mainly. And then what happens is, if that is not maintained over time, you lose the customers, and then to acquire a new customer, B2C is much harder, right? So that's the big challenge I noticed.
Yes, ma'am. Actually, what happens is there are in India, I don't know about the US, in India, many agencies are there who are just individuals who have contacts of these nurses or less qualified people. They just provide the people and charge money. So they make a big chaos or confusions in this market. Whereas these corporates, well-established corporates, do their job well, and they do good business. These are the challenges we are facing.
And
Suddenly, when we call for
when
some patient, they ask, "Are you an agency or a company? Who are you?" They ask. We say, "No, ma'am, we are not agencies. We are corporate service providers," like that. Then only they are happy and try to take our services. These agencies make a big difference, and it's just a second market kind of like.
Yeah. I know exactly what you're talking about. So I experienced it, firsthand. It's terrible, actually.
Yes.
Just low quality, I don't even know where these people come from. But, when it's just terrible. So, so you have to address that problem first. So if you really want consistency and, repeat customers, and you don't lose your customer that you already acquired, because acquisition of customers in B2C market is very high.
And we get NRIs who are in the US. They want to take care of their parents. They come to us asking for. We want a good, reliable person who can stay at our parents' home and take care of our parents. Like that, they ask for a secure and because many harassments and many theft are happening in this homestay duties.
It's a safety issue.
So these are the challenges we have been addressing and coming across.
Yes. So you need to, there is, in some ways, I don't know, there are some, I was actually exploring, partnering a home healthcare agency with these in-home monitors that you have, cameras and whatever it is. There is one company that does that, actually. They install, it's very, it's very non-intrusive, and they kind of partner with these home health agencies to make sure there's a 24-hour security and surveillance and real time to anyone of their children or whoever is living abroad, to be able to see what's going on. So the quality is maintained, everything is maintained. So there's different ways to kind of do this, okay? slice this problem. In US, it is it's a government funded, like a federal funded. You have got Medicare, or if it is a state funded Medicaid. When you have both of those things, right, they have to, even the caregivers have to follow those laws, otherwise they could go to prison. So there is a much more rigor just by there is a fear because of the federal government involved in your care to some degree. Now, if you're commercial payment, then the insurance takes, it takes the front seat. So you've got what I call a police already there. So they're taking care of you. But in India, who is the police? Nobody's a police. That's a problem. So you have to create this policing of your care to ensure that the patient safety comes first. And whatever that partnership is to create that is what is going to assure people that you're not only doing it by ensuring that you're providing proper training to your individuals, because everybody says that, but you have got actually technology in place that shows you time and time again that it is being monitored and policed.
Yeah, ma'am, we are supposed to inform the nearest police station about these candidates who are working with us for the home care, and the patient details, the candidate details, everything we are supposed to submit to them actually. This is how it happens, the proper and right way. And the second question, ma'am, so how do we, like, is there any opportunity for US, any investors, kind of whom we can approach for investments to expand our scale up, to add more services to our platform, and this kind? How do we approach? If you can advise.
When you address the Indian market, what I noticed is you have to have some volume. And then you have to show some consistent data to demonstrate how you're going. And then you may want to start with, reaching out to friends and family around first, and then get their funding before you would go anywhere else. VCs are much farther away. You have to start with friends and family. That's where you would get your best attraction. And if they believe that you have got a go to market, then you just raise the friends and family round, and then you go forward from there. But that requires you to have a lot of structure within your organization. You have to engage an attorney, make sure you got all your paperwork in a row, because they're not going to give you money just like that. They will need to see paperwork. They will need to see legal bindings. So it's a lot of work. It took us approximately, I started the lawyer work in August of last year, and it's literally taken me 6-7 months because I'm not an attorney. And so every document, whether it was 15 or 50, I read it 3 or 4 times before I understood what it meant. So we went through that whole journey of iterative process before we got here. So it's not a small or a less expensive thing. It's a pretty expensive deal. But if you are looking for just some funding, you may want to just start with some family members pulling in some money for you. And then once you have more established, more, you're on the way to becoming a little bit more sustained and a little bit more refined in the business model, you can go after more organized funding.
Okay, ma'am. Nice, ma'am. And I have another last question. Sorry if I'm taking more time. Sorry. So this, hope you are aware of this lab services. So day by day, this lab services cost and the services are becoming, more cheaper and easier method. So how does this, is it a profitable business? Or is it really money flowing? And how does this doctor, patient, this lab people are connected? How do they refer? And so that, because there is a lot of commissions involved to the doctor to write us a lab report, all those things are there. So in this scenario, how do we say, for example, if you're starting or entering into the lab, we are tied up with ThyroCare actually. So to provide our platform, we are selling ThyroCare packages. They're giving us a commission for each referrals. So how does this work? How will be the future of this diagnostic market? So will it be sustainable or profitable? Day by day, it's becoming cheaper and competitive, more competitive.
So how many of you think that all the businesses in India are running in green?
That you have to say. Think.
No, so how many
actually,
of you think that
I studied that many North Indian or lab big giant companies are coming up to Chennai, Tamil Nadu for establishing their business here. One by one, they are coming up. They are investing huge money and resources. So I was wondering, how does this work? Becoming cheaper day by day packages.
No, that's my question to you all. How many of you think that these businesses are actually profitable or making money? Or how many of you think they're all in red?
No,
Anyone?
really, you have to say that.
No, anyone else? I mean, I want to hear. I mean, truly, I mean, just study the market really a little bit more carefully. Look at their stocks and shares if they have if they're listed. If not, they're privatized, you really can get access to their information, but you have to research them a little bit better to see where are they making their money? What is the model they're using? And then how are they, what is their unit cost, right?
No, as I know, currently some two, three companies are establishing in Chennai. They are setting their own big labs, huge money investment. They invest marketing people. They want to identify the branches location wise. They are into huge investment and working to launch their.
And you also have to see when such large companies suddenly come overnight, who are their backers? Look at their backers. Which corporate giant is backing them? Which hospital chain is backing them? Which maybe some foreign countries company foreign corporation is backing them? You don't know.
They show their portfolio very good. Like they say, we have investors though, like from NRIs, this thing, that thing. The portfolio it very nicely.
See, listen, I can sit here and bullshit all day long. You will be able to hear me and know whether I'm lying or saying the truth, right? I mean, you will hear it.
And what exactly the scenario is. That's what.
Yeah, they're all going to say they're profitable. My question to you is, do you, in your fewer experiences so far, do you see that as a profitable business? ThyroCare provides this whole 116 parameters for what, 3,000 rupees or something, right?
Yes.
I did that just not too long ago, so I know.
And they have been acquired by pharmacy for 4,500 CR recently. ThyroCare is acquired,
Fantastic. So now, did they acquire them because they were making money? I don't think so. Okay, they were running in the red, but they were acquired because they have the consumers and the customers. In the healthcare business, every consumer or a customer that you have is the reason you will be acquired at a higher value. It's the promise of the future of the consumers that they can attract, for which they're paying the money. It's not today you are making money or not. They don't care. Okay. Most healthcare companies, even in US, not always run on profits. Okay. But the fact that you have revenues, the fact that you got a customer, like you have 4 doctors, that means I can get 10 doctors next year because I'm a big giant. I have more marketing dollars. I have more power. I have more connections. I can get 10. Your product works for 10 people. It can work for 100 people. That's what they're paying you money for. So ThyroCare got bought over because of what the volume they had, the expansion they had, not because of the money they were making. So don't worry about profit or not profit. If you think that is a market you can target and you can create volume, or if that's the way you want to go.
Listen, the running cost, how do we meet the running cost? Was the question I was wondering about.
That's a good question. I'm dealing with it every day, guys. I've got 14 employees now, 3 in US, actually 4 in US. I've got 10 in India and more to go. And I'm every day, I have to make sure that their needs are met and their paychecks are cut every month before I can think about the 3 of us. So that's the way it works. And it's a question you have to ask yourself, how fast you want to scale. Should you be scaling that fast? Will you fall flat on your face? Should I go a little slower? What is the price I would pay if I go slower? What is the cost? I mean, there is no right answer. You just have to figure it out.
Okay, ma'am.
It's every day I get up and I try to figure out, am I going too fast? Am I going too slow? Am I going at the same speed? Will I become stagnant? Will I lose money? Will I get an investor? Every day I ask the same question. If it was, I'm in the behavioral health business, I think sometimes I myself need some behavioral health intervention because that's how I talk to myself. So I am with you all in this journey.
Thank you so much, ma'am. Thank you.
Anyone else?
Experiences.
Myself, Yashpal. Yes, I am also into management of behavior, mental health and behavior management, ma'am. We have come up with a novel device which is personalized to individual and which in management of withdrawal symptoms in cell. And we have like scientific justification. We have gone for patent publication as well with the same concept. And yes, we are the device which are into management of mental health and behavior management, especially in management of drug addiction. So do you have advice for us? Because
so you are in the device management. So you have a device that actually minimizes the withdrawal symptoms in patients. Is that what you're saying?
Yes, ma'am. Yes.
Okay. All right. So you are something like naloxone. You are in that same space, but not pharma based, but it's a device based. Is that right?
No, ma'am. We are combination based, ma'am. Combination is device plus medicine based. So actually, our device is like medication along with device. So we have combination treatment.
Okay. All right. So, and you have studied, you've got approval in the Indian market. Am I correct?
No, ma'am. We are in state of clinical validation. Our only concept is got we have been established and we have got patented the concept. We are in concept stage and early stage.
Okay, very early stage. Okay, so you're still in the conceptual stage. You've got long ways to go, and you're still looking for clinical validation. And what would be considered a clinical validation in Indian approval, for Indian approval? 300 patients, 500 patients? What is the number of patients?
We are looking at 120 patients, ma'am. That is what the pivot study, what we are aiming at.
Okay. So 120 patients, right? 120 patients, for approval purposes, that may be fine. But, does that really give you, that will give you the green signal to start rolling that out, but it will not be enough for you to know what really works and doesn't work, right? Unless you study a larger segment of population.
Yes.
So the only suggestion I have is, and I can only give suggestions, I don't know, is to kind of see, one is to meet the basic requirement that, you have to fulfill in order to be able to start rolling this out. So get that approval or whatever the paperwork you need to do, and that's 120 patients. And then you still need to continue to push this to study, more and more and more of the patient population, and that will be through beta sites that you will get. And you may have to partner with some de-addiction centers that will be open to trying your product out with their patients. And I don't know, I'm sure there are many de-addiction centers in India, but you may have to come up with a way to target at least 4 or 5 of these clinics, and then continue to do that over 3 or 4 months. Don't give anything for free because they won't use it. So you may have to put a person there in each of these clinics. You may have to make sure that it is being consistently used, that you're collecting the data, more and more data. The more and more data you have, it becomes easier to then say, okay, this really effectively works for 60% of the population with this, and this criteria, and it doesn't work for the remaining 40 if they have X, Y, and Z. So once you have that data, then it becomes easier to then go big scale. So that would be the approach I would take. But if you try to target the larger institutions, it'll become very hard, because larger institutions, the red tape is high. It takes much longer to close a sales cycle, even if it is beta, and you'll waste a lot of time. So you should go after smaller ones. It's easier, actually.
Thank you, ma'am. Just one more add-on, like investment aspect. I am looking at investment aspect, ma'am. What is the stage? Like now itself, I want investors' hand for this, ma'am. But what do you suggest? In which stage of our product life cycle?
There's no hard and fast rule, guys. Honestly, I got an investment when the concept was in my head, and it was not because I would just say it was luck, fluke, in my opinion. I just was talking to somebody and I just happened to get some investment, and that's not always the case. I happen to luck out. But most often times.
What do you think? What do you think about luck? Luck depends on the connections that you've made over the time, right? I wouldn't say luck. You just happen to get into money, right?
Honestly,
So, yeah.
I don't even know if this person, I didn't know this person before that. Actually, I don't know why this person decided to give me money. And my promise to him is that, you will get tenfolds that money back. And I better keep my word or I'll kill myself, okay? But because I definitely would be very embarrassed otherwise. But the point is, you are right, there may be nothing called luck, but, I really believe in destiny and I really don't know why I got the money or the clients that I got. If I sit back and analyze it, I'm like, okay, what did they see, in order for, sometimes we feel that way, right? But the point is, when you are, the only thing that really worked for me is I was able, when I talk about my platform or my product or the business, I am fully in it, okay? 200% sold into it myself, okay? I am lock, stock, and barrel into it. And so when I talk about it, just today, this is a gentleman who had sold his practice, his clinics, dialysis clinics for 70 or $100 million. Okay, he had over 70 clinics. For 40 clinics, 30 clinics or something like that. So he sold it for 100, he's sitting on a pile of 100 million, $200 million. So I gave him a pitch and I didn't have any presentation. I didn't have a laptop. I had nothing. I went with my phone. It was a casual visit and I just kind of rambled on. Now, 10 minutes into the call, he said, he's a fantastic presenter. Okay, let me introduce you to blah, 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 blah. I didn't expect it. I didn't go there with an intent to sell to him anything. I just simply was sharing my story and he ended up helping me. Sometimes it's as simple as that, right? An investment is as simple as that. You just go with an intent to just make a connection. You never know what the possibilities are and you just start talking to them and they end up giving you money and you wouldn't have even asked. And this has happened to me again and again and again in the last few months. And I don't know what else to call it, but luck, basically, because I don't know where to frame it. I go with an intention to just say what I'm doing now. And they say, hey, how can we be part of your journey? I want to be part of your company. I'm thinking, I didn't even want you to be part of my company. In fact, I didn't even come thinking like that. But okay, I mean, if you want to give your money away, I'm happy to take it away from you. So I ended up the conversation, laughing away with it. But the point is, just be really, and it may sound really cliche when I say don't be thinking of money when you talk to somebody. I never think of money when I'm talking to somebody. I'm thinking of how this platform can help, what we are trying to do, and how we plan to address it, and what is the future I'm going after. Because somebody said to me, you're a very tough woman. Yeah, I am a very tough negotiator. I laugh and I'll smile and I'll joke, but when it comes to negotiation, I never give anything for free because I know it is never appreciated. Okay, so I'll charge some money, but I'm also extremely careful that I don't want somebody to come along and then screw around with, whatever we are trying to do. I want them to play along with us. So I'm very careful and very clear in how I set boundaries with them. This is the expectation. You have to play along with us. Otherwise, it's not going to work. It's a two-way street. I don't want to just come and have one more clinic on my list when you're not even going to use my platform. No, I don't want that. So you have to be very clear in what you want to do and be very upfront with it. And I don't know, maybe that's not a very Indian thing to do. In Indian market, it may offend people's egos. I don't know. And when you are in sales, if you are the founder of a company, forget embarrassment, forget ego, forget anything, humiliation. You should forget all that. You will be humiliated. You may be asked to leave the room. You may you may be told, what do you know much about this business? I know better. And don't hesitate to get a no for an answer. 10 people will say no before one person says yes, and be okay with it. They're not being personal with you. They're just simply sharing their viewpoint. Okay, no problem. I'll come back later and move on. Once you develop that particular attitude, then you own the game. Nobody can stop you. That's what I've realized. That's the only thing I've realized. And that's also age for me. I've just become too old. I guess I'm too shameless. I don't know. Don't worry about going with thinking of money or will they give me money? What if they say no? Should I be offended? Will I be offended? Am I going to be embarrassed? Don't worry about all that. Just go with what you have. It may be the worst thing. It may be the best thing. They may laugh you out of the room. Netflix went to Blockbuster. They were laughed out of the room and they asked for the money. But today, they have outgrown and gone so big, right? Blockbuster is nowhere to be seen. So you never know when your time is right. You simply have to hold and know and have fully confident that your product is going to be the best in the market. You go with that, you can convince anybody. You can sell ice to an Eskimo. I don't know.
Thank you
if
for
that
that.
resonates.
I would love to, I'd love to hear how to spray that pixie dust over different things. And I'd like to connect just to understand a little on the US market side, because
Sure.
opening these doors is something that I would like to learn from you. So yeah, thanks.
Sure. I have not learned much in life, but I must say I am an accidental salesperson. I've been thrown into sales against my wishes again and again and again because I just ended up selling. And it was never that I intended to go with a sale in mind. I would go close deals at 20 million, 30 million. It was not with an intent to close anything. I would go there and I'll just, say what it is there, and I'll tell them upfront what is not there, and I'll tell them this is going to take some time. So don't be expecting it and don't come accusing us. And I will just lay it out there. And a lot of times people were appalled, with the forthrightness I would bring to the table, and they didn't know how to be around me, especially when I worked for Indian IT services companies, because I'd never worked with Indians before I moved into IT services. So it was very difficult for them to, be around me because they were not used to being so straight. But what has helped me even in India with the market is just being straight, being just me. I will not be anybody else. I'll just be me, and I'm going to tell you exactly what it is. You like it, take it, don't like it, that's okay. We are friends. We will, we'll definitely connect and I'll move on. But they'll come around. I've noticed that they do come around because they realize that a known devil is better than an unknown devil, because they know what they're getting themselves into. I don't know if this was useful or not, but this is my journey, or our
Very
journey.
true. Yeah. No, very true what you said. Yeah. Thanks.
Are there people who have felt they got something out of this, or I don't know? Shravan? Is Shravan there?
Hello, ma'am. This is Ari.
I can't hear you, ma.
Hello.
Can you be a little louder?
Yeah, am I audible, ma'am?
Yeah.
Yeah. Sure, just got a bit work, but I'm pretty sure startups must have leveraged some of the other information from this session.
You're cutting in and out for me. Is it for others also, or is it just me?
Hello.
Hold on. Yeah, much better.
Yeah, now it's clear your voice.
Okay.
Yeah.
Am I good now?
Yes.
Yeah.
Little louder. I think it's okay. Please proceed.
Yeah. So I'd just like to take a moment to thank you, ma'am, for taking time and interacting with the startups to actually deliver a session on how the evolution period was and where are they going to face those challenges. So I guess must have motivated our startups to provide them, position themselves better in the market now. So lastly, if anybody else has any concerns or doubts, we just take it along. Post this, we'll be closing the session.
Okay. I hope this was useful to you all or not.
Yeah,
I don't
ma'am.
know.
Yeah, it was an informative meeting and sharing. Thank you.
Thank you.
Thank you so much for spending your time
for
and providing a lot of information to us, being a startup companies. Okay. So in future
I'm
also,
learning every day.
Yeah.
I'm
Hope you
being
will also
beaten to
support
learn
in the
every day.
future. Yeah.
Thank you, Dr. Jay.
So nice.
Thank you.
Thank you, T-Hub, for the opportunity. Thank you.
Take care.
Thank you.
Have a good day. Have a good week. Bye-bye.
Thank you, everybody.